Welcome to the Mindset Mirror Connection podcast. In today's episode, I talk with Dr. Molly Bond of Fortitude Chiropractic in Scottsdale, Arizona. We are going to talk about what is a chiropractor, the importance of the specialty in maintaining the health of your body in general, as well as especially during pregnancy and postpartum, and important items she wants you to know. Initially, Molly shares her experience with us of growing up in an athletic field and how she became a chiropractor in the Valley, and important takeaways she wants you to know. So if you're ready, I want you to listen up and lean in because I am about to elevate your mind. Okay, everybody. So it is just me writing solo dolo today, but I've got a new partner, Dr. Molly Bond. So Dr. Molly and I work together with clients specifically on our pregnancy and postpartum athlete population. So she has a higher specialty of care of she does general pop, but I would say a little bit more specialty in like the golf, hockey. What else do you got in there? Tennis. I've seen
Soccer, runners, bikers,
Okay, yeah,
honestly, athlete.
athlete. So
Yeah.
what I wanted to come on because I've been talking about my pregnancy journey and working with different providers throughout the Valley that are kind of in my networking group. I thought Dr. Molly would be a great guest to have on so she can talk about her experience on her side of working with the pregnancy and postpartum athletes and talk about why chiropractic care is important and things we should know because honestly, chiropractic care gets a lot of taboo information about it. So I want her to dispel some of those myths. So that way we can feel more comfortable on finding a chiropractor and working with one specifically that has the credentials that she does. So I think Molly, you contacted me randomly, like on Instagram or something, right? I forget because I
Oh
know we
my
met at
gosh, I
Protein
don't know.
House. Yeah. So I'm pretty sure you contacted me randomly, which I was like, ooh, love that. So I met with her and we just really clicked and kind of had the same philosophies based on training and clientele and just how to communicate needs to clients. And so what we started to do is just create a referral network between each other. So for example, if I have a client that I think would benefit from Molly's care, I send her the information about that client and just give her a little bit of a rundown. Client reaches out to Molly, becomes one of her patients, and then we communicate back and forth regarding that client or patient. And I often make my warm up for the patient or client become what Molly wants them to do for their rehabilitative exercises or their homework. And so then we work together as a team to reinforce what we're trying to get the client to jump on board with. So, for example, if a client is having a hard time getting their exercises and their homework done, we're going to both look at the structure throughout their day and approach it as a team approach of this is what she's telling me, this is what she's telling Dr. Molly. Where can we meet in the middle and influence that person so hopefully they're getting cohesive care? Molly, is there anything you want to add to that?
No, it's perfect. I think the best thing about what you said is the team approach.
Yes.
So the ability to collaborate with a trainer or another healthcare practitioner about the same patient is so powerful for that patient or client. They just get so many sets of eyeballs on them, and working together to create a common goal with that patient or client is just unreal, and they just feel so taken care of
Right.
and heard on all senses. So it's not like, oh well, my trainer told me to do this, but then my chiropractor told me to do this, and so I have 50 different exercises I'm doing and I'm just overwhelmed, and it makes no sense because we're pulling the rope in five different
Right.
directions. It's all of us pulling the rope in the same direction so that that boat gets across the lake as quickly as possible.
Good. Oh, that's a good analogy. A boat gets across the lake as soon as possible. I like that.
Oh
I'm
yeah.
going to steal that from you. So, what I want you to do is tell us a bit about yourself, how you got to this profession. Tell us about your business and anything else you find important and about you.
Yeah, great question. Well, first and foremost, I'm an athlete. So that's really what drove me into
She's a
this field
badass
to
athlete.
begin with. I don't know if I'd describe myself that way, but
I've lifted with you. It's pretty batty.
well, thank you. I very much enjoy all things activity. So first and foremost, I consider myself an athlete. I'm a wife to my awesome husband, Max. He's my business partner as well. I am a daughter. I am a sister. I have an awesome family, an awesome support system. I'm not a mother yet, but I would love to be one day. And so
Hmm.
a lot of what I do and what I'm doing in my life and teaching other people is also stuff that I practice so that I can be as prepared as possible to be a great mom. And that's kind of my descriptions of who I am.
Okay.
How I got here today, um, I grew up as an athlete. I was always kind of the weird tomboy who was always playing with the boys and racing the boys and playing soccer with the boys. Always kind of had that athletic build. And so it's just something I've always been a part of. And I kind of looked for any avenue to do sports of any sort. That kind of transitioned into, which is why I resonate with you so well, I think, is because that transitioned into my middle school, high school years where it really wasn't about sports. It was about how skinny you can be and how much you can exercise and how little you can eat. And I definitely fell into that realm. And I didn't realize it at the time, but it was extremely unhealthy, as I'm sure you preach
Yeah.
to everybody. And so I definitely fell into that realm. And then that translated into college too, where I literally was so fearful of gaining the freshman 15 that I think I lost like 30 pounds because I would eat
What?
like I would eat carrots for dinner. Like
Were
no
you
joke.
playing soccer in college too?
No, I
No.
didn't end
Okay.
up playing soccer in college.
Okay.
Looking back, I kind of wish I would have, but then again, I don't think I would be where I am today if I had.
Yeah.
But yeah, it just translated into this really crappy like view on exercise and diet and was sleeping like shit and all that kind of stuff. So it was just this downhill spiral. And then I don't think it was until chiropractic school that I really had this mindset shift about what exercise should be, what diet should be, and what
Hmm.
sleep and stress and water and all that should be for me. Um,
What age
and
were
so
you in chiropractic school?
uh, I graduated when I was 25.
Okay.
So I would have started when I was 21.
Okay. So from essentially, we'll say middle school. So what we're like 12 in middle school, I think.
Yeah.
So like
Yeah.
10 years of your life, you're feeling like eat less, move more, don't want to gain weight, fearful of eating, sleeping like shit. And it's so interesting that that story comes out in so many of us in a different way, right?
Yes.
So
Yeah.
I just wanted to give some context to that for the audience that's listening is like we didn't all of us we haven't like even us providers have not had this figured out forever. Like we went through our own part of realizing like, oh, I can't do this like this anymore. And even then I bet you it was still a struggle for you to untangle that web.
Yeah. And it still is some days.
Yeah.
Like it's funny that we're chatting today because literally this morning I weighed myself for the first time in like months or
Yeah.
something. And I weigh more now than I ever have. I weigh like
Uh-huh.
150 pounds, which
Yeah.
is not everybody thinks of that weight like, oh gosh, that's a lot of weight. And so I had this moment where I went backwards in my mindset and I was like, oh shit, I have to start running more. I have to like maybe I should start eating less. And we've been eating so much. I was like, hang on. I have never deadlifted this much in my life. I have never squatted this much in my life. I can run 4 or 5 miles easily. Like, so I just had to be like, hang on, like that's not the view that I want to take on it.
Right.
It still gets me and I'm still
Yeah.
untangling that web, I
Yeah.
guess.
Well, and you also are very, so like you said, you're very strong, but you've got an awesomely lean body. And I know we're not supposed to like comment on women's bodies and we try not to, but for context, when you have more muscle mass, you're by default going to weigh more.
Yeah.
And so that's always a mind fuck for a lot of our clients too, is to say like, okay, I am way more, but I look leaner if I did my measurements. Like I bet if you did like waist circumference measurements or hip circumference measurements, they're tighter, but it's that this scale has played such a role in our lives. And we're not really going to focus too much on this today, but I really appreciate you sharing that because, again, providers don't have it all together. We still have our own struggles, but I think that's also what makes you who you are and someone that I appreciate in our space because I know that you can relate to clients about that too. And that's something that you can walk through with them, not just about their body mechanics and like the need to do mobility, the need to work on these intricacies that they're feeling, but also the need to take care of yourself mentally. Because if we're not taking care of that, we can do all these physical things, but it doesn't really matter.
Yeah. Yeah.
Well,
I
cool.
totally agree.
So tell us
Um,
about your business. I'm curious on that too.
Yeah, my business is Fortitude Performance Chiropractic.
Okay.
We are located in Scottsdale. The main thing that we focus on is really making sure that we can get somebody the outcome that they're looking for.
Uh-huh.
A lot of offices are very focused around pain management and let's get you out of pain. Let's get you um, let's get your low back pain feeling better. Let's get your shoulder feeling better. Let's get rid of your sciatica if you're pregnant, that type of things.
Hmm.
But really the thing that we really focus on is what outcome are you looking for and why are you looking for that outcome? Because if I don't know that goal and why you have that goal, I don't know how to break it down to create a plan to get there.
Okay.
So really everything is extremely tailored to the individual. It's very customized, and really we do work with the athletic population. And shocker, women get pregnant when they're athletic too. So I
Whoops.
think people forget that.
Yeah.
But there's not really I'm not saying there's not a space, but there's less spaces in the community here where you can be an athletic female who is strong or extremely athletic and go into a women's health clinic and get the care that you need.
Right.
Typically it's walking in, and there's nothing wrong with this, but it just doesn't fit this population. You're walking in and you're seeing these little pink 5-pound weights that, like, if somebody told me to shoulder press those, like, it ain't happening. I could like pinky curl those
Right. Right.
things.
Right.
it just it doesn't fit the needs of what the athletic population has. And so, like, say you're a CrossFit mom or something, and you really want to maintain that and be able to stay strong through pregnancy. If you go into that office, they can't load you the way that you need to be loaded and watch you move through a squat because they don't have a squat rack and they don't have the weights to load the squat to watch you squat.
Uh-huh.
So it's the thing that we've really been able to create is that athletic space to be able to load athletes properly. And then I also have that extra piece of knowing what's happening as the pregnant body changes and as it progresses through pregnancy. So
Hmm.
adding both of those together has been really, I'm just grateful that I have both of those things because I think that space is unique.
So did you learn this in school, or was this extra training that you received, or how did that work?
The pregnancy part.
Yeah, yeah. Or even the athletic part with the pregnancy part that you're blending.
The pregnancy part was a lot of additional courses that I've taken.
Okay.
I'm a Webster certified chiropractor. So that's typically how you know someone works with the pregnant population in postpartum is they're typically Webster certified.
Oh, okay.
And then there's additional courses you can take that are like more of the athletic base. I don't know
Okay.
if there's really names for them, but I've taken courses on, the athletic population who gets pregnant. So how to assess the squat when there's a big belly in the way, how to assess the deadlift and change things with the belly in the way, and how the pelvic floor correlates with that. Side note, I am not a pelvic floor therapist, nor do I work on the pelvic floor.
Okay.
I definitely refer out for that. But you have to understand the correlation of that to know when to refer and when that referral is needed.
Sure.
So that's definitely been additional courses. I did not learn that in school. I did not learn the phases that the body goes through, the changes that the pelvis undergoes, the changes that your hormones go through, the ligament laxity that happens. I didn't really learn that in school. And then same with the athletic side. Most of that probably comes from my experience being an athlete, but the courses that I take tend to be more exercise and rehab based.
Okay.
And then I take that and I apply it to the athlete. So I've definitely taken stuff that is more like rotational athlete specific, and
Yeah.
rotational athlete being golfer, hockey, soccer, tennis, etc.
Uh-huh. So
So
when we're looking at that, you had made a comment in one of your other statements that you aspire to be a mother at some point in your life, and that you take things that you do with clients and apply it to yourself. Are there certain movements that you recommend certain clients do, like in the pregnancy or athletic population? Or we'll say, actually, let me break that down a little bit.
yeah.
For what you've done for yourself, do you recommend those for an athletic person? Then would those translate during their pregnancy and postpartum, or does each, we'll say, phase of that cycle require different skills or different movements based on what's happening with their ligaments, their bone structure, or anything like that? Does that make sense?
Yes, it's a great
Okay.
question. Um, I don't know if there's a one answer to
Oh,
what
okay.
one person should be doing or should not be doing
Right.
because everybody is so different and everybody moves so individually.
Hmm.
Generally, you want to have the big movements down packed. So, like a squat, a deadlift, a push, a pull, a carry, a lunge, things like that. You want to be able to do those things because those are the activities. A deadlift is you picking up your kid off the ground postpartum.
Okay.
A squat is you sitting on the toilet,
Yeah.
and a lunge is you getting down on the ground and putting them in their carrier. And
Right.
then a carry is carrying the carrier. Stuff like that is those essential movements, but one specific like move, I think is all definitely individualized to what that person needs. But I definitely think in general, everybody needs strength training
Okay.
during that or some type of stability work. I don't need you necessarily squatting 250 or anything like that. If that's your goal, then sweet, let's do that. I'm
Hmm.
totally. But in general, everybody needs some form of stability as that hormone relaxin is pumping through your system and creating that laxity in the ligaments.
Right.
When those ligaments get lax, then the surrounding structures are like, okay, we're relaxing, we're chilling, but then the muscles say, oh shit, like we're loosey goosey. I got to get tight in order
Hmm.
to provide stability. And then that's when we feel all that tightness and that restriction through the pelvis and oftentimes the sciatica too, is that everything is so tight because it doesn't know how to contract properly and create stability.
Yes. And that's what I often tell clients too is when they have a point of pain, I'm like more, and they think, oh, I just need to stretch it. I just need to stretch it. I am often like, honestly, what we probably even need to do is stabilize and strengthen it, which is
Yeah.
really contrary to what you find out there of like, do these stretches for tight hip flexors, do this for, a tight low back. And it's like, well, why is your back tight in the first place? Because more likely than not, it's compensating for something else. And
Yes.
that's one thing. And I would be curious to get your thoughts on this because, and I wonder if in the chiropractic space that you guys see a lot of like generalized programming and not in the sense of like strength training, but generalized fix it. So fix this for your low back pain. And for me, I've seen some chiropractors almost advertise that like we fix your low back pain. And then all of a sudden you're going in there twice a week for the next 3 years. And people feel like, oh, I just need the adjustment. And then that gets it better. And I'm like, well, but wait, have we addressed the imbalance or like why we need the adjustment or where this pain is coming from? Or like, have they talked about strength training and stability work? And the answer is usually no. And I'm like, okay, here's Dr. Molly. Like, let's go. So do you have any thoughts on that of just kind of, I guess my question for that would be, what is the benefit of going to someone who's got your specialties and who has a private practice and who works so hands-on as opposed to your general chiropractic care that's kind of been promoted out there?
Hey, what's up, guys? Quick interruption from our sponsor, the Mindset of Matter coaching program. If you are tired of gaining back the same 20 pounds that you lose over and over again, if you're tired of having to work out 5 to 7 days with only seeing results that you do not desire, or you are just tired of living in a body that you do not feel confident in, you will want to take advantage of this month's offer. For the month of May, we will be offering $100 off our Mindset Matters cohort style coaching program. In this program, you will receive curriculum and coaching to help rewire your mind to create new beliefs about yourself and ultimately gain the outcomes that you desire. In this program, you receive weekly reflections in the Mindset of Matter app. Each reflection is a part of the mindset method. On top of this, you also receive daily journal prompts to help enhance the things that you're learning or enhance the tools so that you can solidify them and utilize them moving forward. On top of this, you get access to myself or one of my coaches in a weekly group coaching call. In this call, you are able to ask questions and get coached through the reflection and the things that you're learning. The next cohort starts June 3rd. And again, for the month of May, we'll be offering $100 off. If you're interested in this, you'll find the link in the show notes below. Now, back to elevating your mind.
I will say everything is really based on what you want as an individual.
Hmm.
So as long as somebody is ethical and they're helping somebody, if that's what you want, then that's cool with me. But it's the people who are looking for a long-term solution and want answers and want a plan that's not what you're going to get at the cookie cutter places because it is truly a cookie cutter approach. You're going to go in, you're going to lay down on the table and it's going to be the same 7 adjustments no matter what your complaint is. That works for some people. It just doesn't work for everybody.
Right.
And in most cases, in terms of pregnancy, postpartum, it just doesn't work and it creates reliancy on that adjustment. An adjustment is a tool that we have in our tool belt, but it should never be the thing that you rely on to feel good. So the difference is not having that customized approach versus having somebody who says, okay, here's your low back that's tight, for example, or you have sciatic pain. That's your diagnosis, yes. But why do you have that diagnosis, and what's actually the root cause of your problem?
Got it.
Once we address that, the pain tends to go away. But if we don't fix the why, it's just going to keep coming back. An
Mhm.
analogy I like to use is a barking dog. It's like if my dog is barking at something in the backyard, I can tell him to hush up all that I want and tell him to stop barking. But it's not until I look outside and I see that there's a rabbit in the backyard that he's barking at that I'm actually going to have to take care of the rabbit in order to get him to stop barking. So he's just going to keep barking and barking until I take care of the rabbit. So it's a stupid analogy, but it's
It
true.
works.
You can put a Band-Aid on the symptoms all you want, but that's going to create dependency on those adjustments, and that's when you're going 1 or 2 times a week,
Okay.
every week, for the rest of your life. Whereas it should really be, okay, here are my goals, and here's what I want to achieve, and this is the type of birth I want to give. This is the type of postpartum recovery goals that I have. This is why I have those goals. How do we break those down and create a plan to get you there? And everybody's plan looks different. Some people get adjustments, some people get soft tissue work, some people get dry needling, some people get exercise, some people get strength, some people get stretching, all the above.
Right. So what I'm hearing from you is it's important that anybody who walks into a chiropractic office feels like they're getting what they want to get out of it, plain and simple, no matter how that is delivered, but
Correct.
also that they're feeling heard, which we always talk about is important. Coaches or trainers or professionals, providers, doctors should hear the pain or the problem, but that they also feel like they're getting relief at some point. And I think one thing to note is just because you go doesn't mean the relief is going to happen automatically. It
Yeah.
takes the patient, helping support what you're trying to do, as well as you educating them on why we're doing that. Just like strength training, like they don't come to me for one session, all of a sudden they're like banging strong. It takes over time, but it also takes some collaboration, cooperation. So, with that being said, I think it was interesting because we jumped around a little bit from pregnancy and the specialties that you have with that, and then going into the general pop and kind of how chiropractic offices can work. And I want to circle back to bring those two to a tie. So, you're saying we need a specific approach to that individual. And what I want to do is create an avatar for you and say, we've got this gal. She's 33 years old. She's in her first trimester, second trimester of pregnancy. She has a history of, she's an athletic background, no sports specific, but strength trains. What are common ailments that you find this population in the pregnancy era dealing with? And what are some things that you could say, typically, this is what we would use to take home? And now I know it's a very individualized approach, but what are you finding in these populations that is a reoccurring theme? And then what do you like to do to kind of coach them and treat them through that?
So you're meaning like specific like diagnoses that I'm seeing and
Yeah, so
like
like
common
for
treatments.
example, most of the time they start to have kind of like low back pain,
Yeah,
or
okay.
like their hip flexors start to feel tight, or their thoracic starts to feel tight as the belly starts to grow. So, or like where, and I'll ask you about postpartum, but postpartum they start to feel like shoulder tension or wrist tension. So my question is, what are you typically seeing? And we kind of touched on some of them. And what are some movements that you find are important in pregnancy that you provide or that they could do at home? Now again, for the audience that's listening, this is not saying you should do these things. Again, we're heavily promoting individualized care as the best care, but this also gives you a baseline of kind of what Dr. Molly does and also what you should be looking for with care and some expectations to have.
Yeah. I mean, the number one thing I see is low back pain and sciatica. And
Really?
that sciatica, yeah, is the sharp shooting pain down your leg, your butt, your hamstring, back of your leg, essentially.
Uh-huh.
The most common thing with that is typically it's because that pelvis is starting to dip forward as your center of gravity changes.
Mm-hmm.
And then pelvis is really opening up. So without the strength training, the glutes are becoming elongated and then they try to get tight as a result. So then we're compressing on that sciatic nerve and then it shoots down the leg. So less commonly is it actually like a disc problem in my pregnant women. It can be, and I've seen that before. But more commonly than not, it's like tight muscles around the glutes that are compressing on the sciatic nerve. shooting pain down the leg. So the most common thing that helps with that is glute stability work.
Butt stuff.
Yeah.
Lots of
Butt
butt
stuff.
stuff. Yeah.
Yeah.
That's what I always
Yeah.
say. Butt stuff. We do lots of butt stuff.
But yeah, that's probably the most common thing I see. Second would probably be pubic symphysis pain.
Okay.
So pain right in the front of the pelvis on those two bones, right under, like, I would say like belt line area.
Uh-huh.
It's also called, like, I think it's called lightning crotch is what
Yeah, yeah,
people
yeah.
call it.
Yeah.
Yeah. And so that sharp shooting pain, and that can totally be a nerve thing, and that typically comes later. If it's a nerve thing, it's typically like weeks 36 and up,
Uh-huh.
but it can also be an adductor problem, like a groin muscle problem.
Okay.
Because as your pelvis tilts forward, the adductors become elongated and have to eccentrically hold on this whole entire time, because that's where the adductors attach, is on the pubic symphysis, and then they attach on the inside of the knees at the bottom. So when the pelvis tilts forward, adductors become elongated and stretched, and then they just get really, really pissed off as they're starting to pull and tug on that pubic symphysis for so many hours of the day as we're walking around in that anterior pelvic tilt. What typically helps there is teaching those adductors how to eccentrically load. The most common things that help is teaching the body how to posterior pelvic tilt. Again, glute activation, lower ab activation. And then secondarily, I typically will give people like an adductor rock back type thing. To just teach those adductors that eccentric load is okay.
Okay. So question on that, do you find those problems in more of a certain population, so more of your golf population versus maybe your CrossFit population, or those are the two most common no matter what the athlete is?
Those are the two most common no matter what the athlete is, because most athletes have the same problem.
Okay.
And then from there, I would say after that, it's probably the mom wrist that people get, even like pre-baby. So even like during pregnancy, we get a lot of like the carpal tunnel symptoms. And that's because that pelvis is starting to dip forward. So then thoracic spine starts to round a little bit, and then we get tension through the pecs because center of gravity is just pulling us in all different directions. So those are probably the three most common things that I see. With that, it's all about maintaining thoracic mobility, core stability, and then making sure those pecs stay nice and loose. That's usually a lot of manual work that I do with those people. But then also building back strength and opening up the chest. And so again, a lot of strength work. So, yeah.
So let's go into the postpartum population. What are the common things you see there?
Upper back and shoulder pain is the most common. Yep.
So now we're going upper body versus lower body.
Yeah. And I honestly didn't expect that when I first started practice, which is about almost 4 years ago, which is bananas. But when I first started, I was like, okay, I have my first postpartum patient. I guarantee they have low back pain. And none of them do. It all just like goes away. And well, some of them do. But for the most part, it's that upper back and shoulder and almost like neck tension that they feel from carrying baby around. So we're here the whole time, and we're now carrying around this baby, which is amazing. But at the same time, whoever taught you how to hold something like that all day, every day, you're figuring out odd positions to breastfeed in if you choose to breastfeed. You're potentially co-sleeping with that kid. You're lifting up and also having to do typically household stuff too. So you're cleaning and bending over and trying to take care of yourself in the meantime. So it's a lot of tension and flexion of that upper back. Go ahead.
I was going to go ahead. I want you to finish that because I had a thought of, so when we're going into pregnancy and postpartum, you're talking about the need to strength train to focus specifically on the glutes, the adductor, so the inside of the thighs, the back, and even chest. Are there other things that you recommend that these athletes do to take care of themselves other than just like strength training? Is it like seeking support, their nutrition? Because I know like working with you that I want you to touch on more than you just treating the body. Because you definitely do that, but I know you and I want you to share how important that is as well. And like for the audience that's listening, this is what a provider who is invested in your health looks like. They're not going to just treat one thing and go, looks like your big toe's good. They're going to look at the whole foot. And then they're going to go, what are your shoes that you're wearing too? You know, do you have tiled versus carpet in your house? Like they're looking at the bigger picture, and Dr. Molly does a wonderful job of doing that. So I do want her to share some of that as well, because we've talked about these ailments with the postpartum pregnancy that they experience, but it doesn't often just stop there.
Yeah. Thanks for that awesome intro there.
You're welcome.
Pain is so multifactorial.
Mm-hmm.
It is rarely one thing and one singular line that we have to go down. It's often, okay, we have to think about the musculoskeletal systems. We have to think about muscles, joints, ligaments, strength, mobility, stretching, things like that. Yes. But the role that nutrition plays is unreal. Like, are you eating enough? Are you eating foods that are taking off your body? Are you sensitive to some food that's really creating a lot of that inflammatory response? So food is huge. And honestly, I think as women, we tend to be scared to eat enough food,
Mm-hmm.
especially postpartum if you're breastfeeding. Like you have to produce extra calories you have to consume extra calories to produce more.
Sure.
So that's something that people forget. So nutrition is huge, and that's definitely something I touch on with my patients. I don't create nutrition plans. I'll typically refer to a dietitian or
Mm-hmm.
nutritionist of some sort in that sense, but I definitely touch on it and ask about it. Water intake is massive, 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 and not just water intake, but how are you consuming that water and how are you using it? So using electrolytes to actually use that water. Stress management is a big piece of what I touch on with especially my pregnant and postpartum women. I'm not a mom, but I've seen it so many times where we just put so much stress on ourselves about wanting this perfect pregnancy and this perfect postpartum recovery and this perfect body afterwards and having to cater to all these things that women are supposed to do. I'm putting that in quotations for anybody who doesn't see this. The stress levels are just extremely high. And so managing stress is a huge piece of how your body presents with pain physically. And then the last one is your mental health too. And again, that's not an area that I specialize in. I sometimes feel like I'm people's therapist, but if there's something additional that we need to address, like postpartum depression, postpartum anxiety, that's not my area of expertise, but it is my job to make sure that I'm asking those questions so that they get the support and the help that they need. All of those things play a role in your pain and how your body presents and how it changes through pregnancy and postpartum as well. We call it the biopsychosocial approach. And if you don't take that approach, I truly believe that you don't see the full picture.
So you could be doing all the exercise things right, but if your sleep is trash, your nutrition's trash, and you're kind of getting water, you're still going to be running in the same circle.
Yeah, I didn't even say sleep, but yeah, sleep is huge, 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 huge.
But you
That's when
mentioned
your body
co-sleeping with the
recovers.
baby.
Yeah. It's when your body recovers, and if it can't do that, I hate this saying, but it's true. It's like you have to fill your cup so that you can pour into other people's cups. Again, I hate that saying, but it's true. You have to be able to take care of yourself so that you can provide for this new little one that you're carrying around. So yeah, I think it's huge.
I think another thing to note too is when we're talking about the postpartum period and taking care of yourself, that there's this, I don't know if it's social media or like well, I'm going to go, it is social media, that there's this anxiety of returning to exercise quickly. And I imagine for your population, again, working in the athletic population. So what we mean by that is Molly works with more high performing athletes. So yes, this is not just like your casual kind of gym goer. They're going to be more of a dedicated CrossFit, dedicated golf, where there's a lot more going into their bodies and their structure throughout their day that is built around these performance sports. And so what I imagine is they probably face the same problems that the general population does of they want to get back to movement, and you're over there going, I just don't know if it's not that we can't, but if we do, we need to prep our body for it rather than just diving back in. Would you say that's true?
100%.
Yeah.
I will give you an example.
Please do.
I treat this high-level golfer.
Okay.
She's amazing. She's probably one of my favorite people in this whole wide world. And she had a baby, I think almost a year ago now, which was crazy to think about. And the return to sport and the pressure that she felt to get back on tour was kind of interesting to watch. And she's probably the highest level athlete that I treat. And she's just a freak athlete. And she was wanting to get back into what mobility thing can I do to fix this, and what exercise can I do to fix this, and I just need like this 10-minute routine so I can kind of get back into things. I want this thing that I can do. And it was just like, what are these million things I can do? And I was like, hang on, let's start with a pelvic floor therapist, because she definitely needed one. Let's start there and build the foundation of your house, because you cannot build your house on a faulty foundation. So let's build the foundational pieces. And then I understand that you're at this high level of performance, but the foundational pieces are still needed. And it was hard to fill that gap between where she wanted to be and where she actually was.
Yeah.
That was a really hard case for me to manage, because it was almost like a mental piece that I had to handle.
Yeah.
But yeah, they struggle with the same thing. I want to get back to this as soon as possible. And there's so many external things that people see, like, oh, get your stomach skinnier in 6 weeks with this, and lose the baby weight in 2 weeks with this special drink, or whatever it is. I don't know. I don't
I haven't heard of the drink one yet.
I made it up. I'm sure there's
yeah,
shit
it's
out
fine.
there.
There's a drink out there. We'll find it. We'll get targeted ads once we're done with this call.
I know, but people they see that and they're like, oh, that's normal, as opposed to the realistic, like, okay, let's take it step by step. And postpartum means something different for everybody.
Right. And part of my reason was asking that question, because I knew the answer, but selfishly, I want the audience to hear, because most of our audience is going to be high achieving women. They have an athletic background and they work out, but we think there's athletic performance in like a high level performance athlete. Like, so for example, this gal that you're talking about that plays golf, like specifically as a career, or does CrossFit as a career, whatever, insert career and performance base. But then we have clients who are often like, well, I'm not an athlete. I'm not an athlete. And I used to think about this for myself. And then Dr. Lisa Palmer was like, no, you're kind of an athlete. Like, if you're doing this. And I was like, really? I never considered that. But we have to remember that. So athletes that have all of the skill set to do this, like they can do the performance-based, like mental health therapists. They can go and get people like Dr. Bond, and they can go and get the pelvic PT, and they have all the information available. They are still struggling with the common thing that we see in the common woman who doesn't consider herself an athlete. So even if you go to the gym once a week, you're still vulnerable to the struggles that the person who is going to the gym every day and working on something that is part of their job and their profession. And so that's why I wanted to ask that question and have you answer it from a different perspective of, it's hard. It's really, really, really hard. And it's okay for it to be hard. But we also, like you said, we have to take care of that foundation, because if we don't, whether it's through strength training or pelvic PT or chiropractic care, naturopath care, or doctor care, hormone levels, your mental health, that house is going to be pretty empty and built like almost like styrofoam. And then a big storm's going to come through. And that big storm could be maybe you and your husband fought, like something as simple as that, or your significant other. Or a big storm could be as big as like maybe there was a death in the family. And if we don't have that structure there to help support us, whether that's physically, mentally, socially, nutritionally, it's all going to start to crumble down. And like you said, sometimes the pain is there, but the pain is coming from like an inflammatory food source. So if we're using food to cope, which we have clients do that, and often people who come and work with us experience that they're using food as a coping mechanism for their managing their emotions, thoughts, and feelings. Or if we're working at a high stress job and we just had a baby and then we're under eating because we want to lose the weight, you're kind of running in a circle there. Anything you want to add to that?
No, very well said. You're susceptible to it, and I hate to generalize everybody, but in general, it's hard. And it's important to have a solid team of people in place to help you manage that tough time. And there are people who will say it's the easiest thing in the world, and cool, I hope that it is, but in general, it's tough. So be prepared for that and understand that there are people out there to support you through that tough time too. So, yeah.
So question, well, I want to wrap up, but first I want to ask is there anything else you want the audience to know, whether that's about your business, yourself, general chiropractic care, pregnancy, postpartum, athletic population, anything you find important. And it could touch on all of those too.
Yeah. The first thing I want to say is the people out there that have been to chiropractors, PTs, massage therapists, naturopaths, things like that, and you still don't see results, don't give up, because there are people out there for you.
Mm-hmm.
And stand up for what you think you deserve, because a lot of the time it's like, oh, I can't help you, I can't help you. Then you give up on that and you think that this is how it's supposed to be. And it definitely does not have to be that way. There are people out here to support you. And if it's not me, if it's not other chiropractors I know, or you or somebody else, then I know for damn sure I'm going to help you find someone that can support you.
Mm-hmm.
So there is a support team out there for you. The next thing I want to touch on is chiropractic care in general. Again, whatever you deem as chiropractic care is subjective to whatever you think you need. But for the people who want individualized care, it's definitely out there. And there are great providers out there. There are ones that I don't fully agree with how they handle things. I don't tend to agree with the come in, lay down, rack and crack out the door in 2 to 3 minutes. But there are offices in the Valley, and I know them because I work with them and I love to be part of their circle, that hop on a phone call with you and ask what's going on and genuinely care about whether or not they can actually help you. And if we can't, we get you to somebody who can. So again, it all comes back to support. And then finally, if you're a female athlete, if you're looking for a space that fits your demands, there are spaces like that too. It may not seem like it in all these women's health clinics that have the little teeny pink weights, but there's a place for that too. Don't get me wrong.
Right.
But there needs to be a space for those people who need to be loaded properly. And there are spaces like that. I'm one of them, but there are other places in the Valley too.
Mm-hmm.
So that's pretty much it. Is generally, I just want people to know that there is support out there for them.
Well, Dr. Molly Bond, if someone was listening to this and they want to work with you, what's the best way to get in contact with you, or where can we find you on social media?
You can find me on social media. My Instagram is probably the easiest way actually to get a hold of me, and that's at PHX_Fortitude. Fortitude, not the number 42, because sometimes it sounds like that. But Instagram is probably the best way. You're more than welcome to check out my website, fortitudepHX.com. Shoot me a text, 480-771-7098. Had to remember that real quick. But yeah, I'm easy to access. Shoot me a text, shoot me a DM. We'll get you all figured out and see how I can help.
And we'll put those links in our show notes as well. That way people have easy access to them.
Awesome.
So anything else you want to touch on?
Thanks for having me. It was actually such an honor to be on this show, because I resonate with you so much, and the messages that you guys send to us women who are, whether or not you deem yourself as an athlete or not. If you're active, you're an athlete, I think. But you guys portray this honest and real message to us, and I really appreciate that. So thank you for having me.
I know. When you reached out to, you're like, hey, listen to your podcast. I was like, sweet. Yeah, cool.
Yeah, I love it. I do every week.
We really do. Oh, we appreciate that.
For sure.
Okay. Well, wrapping up. So that is Dr. Molly Bond of Fortitude Chiropractic. If you want to work with someone as badass as her, reach out to her and she will connect you to others. But also, if you're in the Phoenix, Scottsdale, we'll say North Phoenix. I mean, I would say in the Arizona area. Shit, she's worth the drive. To go hit her up, follow her. She's got awesome content on their Instagram, especially if you're in that athletic population. She's got a beautiful office with a beautiful gym in it too. I cannot highly recommend her enough. And so I'm so happy that we were able to have her on. If you have any questions for me or want to reach out to me directly, you can find me at fitbyamanda.az. And remember one thing, what you say in the mind, you see in the mirror.